I get asked all the time, do people panic at the end? I think it's a misconception that people think someone's alive, they suddenly realize they're going to die, and then they panic! They panic because they're dying. Let's clear this up. My quick and easy answer is no. I've never seen anyone panic at the end of life. But let's get into it. Let me explain why there's this misconception and why I never see someone quote unquote panic at the end. The misconception happens because so many people have not been around death or have seen death or know what it looks like. And to be clear, I am speaking about a hospice death or some kind of gradual death, right? Not all deaths are like that. Sometimes there's car accidents or gunshots. I'm not talking about those kinds of death. I am talking about the gradual kind of death. The misconception happens here, like I said, because one, people don't see it often, so they don't know what it looks like. They don't know what to expect. Television and movies do not do us justice. We do see people on TV and movies, being very, very awake. And they usually do show them having a peaceful death, but they show this version of death that's not real, where someone is awake and alert and laying in bed and able to fully speak and basically look and act like themselves, and then slowly just close their eyes and die. And that is not how it happens, which is why I can tell you that most people don't quote unquote panic. And they don't panic because it is a gradual thing that is happening. Now, through this 3 to 6 months to a year to 2 years of this gradual decline, they may have moments of having anxiety, fear, possible panic, right? Because they don't want to die or they're afraid. That's very, very normal. But at the very, very end of life, hours before someone dies, days before someone dies, most people are fully unconscious. There is a whole transitional phase that we call transitioning that goes into the actively dying phase. In the actively dying phase, the last phase of life that I truly believe is built in us to help us die so we don't have these panic moments or we don't feel like we're suffocating or we're grasping at straws, trying to stay alive. That doesn't happen because our body is built to die and it helps us gradually do it. And when the person is in the actively dying phase, they are no longer conscious. They are not eating and drinking. They are not waking up. They are having changes in breathing, which is purposely happening because our bodies are shutting down. So the body is doing it. There's metabolic changes, which causes the person to breathe different. It's not the person suddenly realizing, I'm dying, I'm gonna hyperventilate. That's not what's happening. The body's slowly shutting down, changing metabolically, and then causing the person who is unconscious to breathe different. I never have seen someone quote unquote panic because they have always been unconscious. Only because I feel like I can hear my audience already saying to me, hey, what are you talking about? My dad panicked, my mom panicked, so-and-so I saw panic. Let me address those people in my audience right now. I'm not saying this can never happen. I'm sure there are certain circumstances where it has happened. In one particular circumstance I can think of is someone with COPD, which is a lung disease, or CHF, which is a heart disease, where they have moments and periods of time where they do feel panicked because they feel like they can't breathe or they feel short of breath. That definitely can happen over this decline. There can be moments where this person has certain symptoms pop up suddenly. They can't breathe, or they feel short of breath. They're having such severe pain, they don't know what to do. Those moments can happen at the end of life, and those moments need to be treated for sure, which they will be on hospice. They should be anyway. But I wouldn't consider that someone panicking at the end of life. That's symptoms that could arise that can make you feel scared at the end of life. And those very rarely happen during that actively dying phase. Also, I'd like to address if this has happened to you, which I'm sure it has happened to some people where their loved one did seem like they were struggling at the end of life. I feel like this is why I've developed my whole entire channel, is because I know those things have happened. I've been in a hospital setting where someone is panicking because they're in a hospital setting, they don't know they're dying, they haven't prepared themselves, the family hasn't prepared, so there's this big kind of panic moment, which I think is incredibly unfortunate. And it happens because we live in a death-denying society. And our healthcare system is also death-denying to some extent, right? We're constantly trying to keep people alive at all costs, avoiding conversations, avoiding talking about difficult things like death, which creates panic, or it can create panic. This is the whole reason why my page has developed, to try to help that from happening, to try to increase the education, to decrease moments of panic.
Hey guys, we're gonna get back to the video in 1 second, but I just wanna let you know that there are more resources out there for you. I have a book, I have a workbook, and I have an online class. All of those things will be in the description, so if you want more help, it's there for you. Okay, back to the video. Bye.
One thing I always love saying to my hospice patients, and I did not come up with this, I'm not sure who did, but whoever said it is a genius. Death is not an emergency, at least a hospice death. If you are on hospice, you and your family should know that you are on hospice to live out the rest of your life. But that does mean we know you're at the end of life, and you will have this slow, gradual decline. And as that happens, as long as your person is comfortable, there is no emergency. Now, if they are uncomfortable, you need to make sure you're on top of that and calling your hospice company, making sure your loved one can be comfortable, or you, if you are the person on hospice, you are comfortable. But the whole act of dying, being in that actively dying phase, is not an emergency. In fact, it's the most normal thing that could possibly happen in this situation. And our bodies are built to do it. So while they are in that actively dying phase, although they can look very different, hence why I have many videos of real life actively dying patients. Please go watch those videos if you can. So you can see what the person will look like, what your person may look like during that actively dying phase, because they will look different. And a lot of people can associate how they look with something being wrong or their loved one panicking or struggling. And that is usually not the case. They usually just look very different, they breathe very different, their coloring's different, right? So it can be associated with some negative things that really are a very natural part of death and dying. So personally, as a nurse who's been a hospice nurse for around 9 or 10 years and an ICU nurse before that, I have never seen someone, who was hours to days close to death panicking or being awake enough to be panicking. I have never seen it. And I think once we understand that a little more, once we understand how our body works and how our body helps us die and how our body can take care of us at the end, we'll better understand that words like, is someone suffocating at the end? Is someone panicking at the end? That usually, again, I like to say usually because I know there are some people out there, and I'm so sorry for your experience, that probably have experienced this, but generally speaking, that is not happening. Specifically on a hospice death or a death where someone is gradually at the end of life. Their body is knowing what's happening and knows what to do and knows how to take care of them. And I know that there have been times in people's lives where their loved one was in the hospital. It did feel like a panic. They did see their loved one struggling to breathe or panicking because they didn't know what was going on and possibly they were dying. And that I can say usually, because I worked in hospitals, usually happens in the hospital. That is what happens when you die in the hospital. Now, that is no one's fault. However, I do feel like if we as a society and we as healthcare professionals talked more about the dying process, more about the disease process that your specific loved one has, we would be better prepared for end of life, and then there would be less emergencies. Because emergencies happen at the end of life when people aren't prepared, when they don't know what's coming, when they don't know what to expect. They panic, of course. This is their loved one. Their loved one's saying things that make them scared and they're uncomfortable, so they panic. Take them to the hospital. The hospital is built and made to save people at all costs, right? So it's very panicky, it's scary, and it feels very emergent. And I understand that, and I've witnessed it with my own eyes. And I think that's where we lack as a healthcare system and as a society. We just want to be so death denial because it feels too uncomfortable to try to talk about it, so we don't, and then we end up with these dramatic, traumatic death and dying scenarios. And I've just seen it too many times. I've heard it too many times. Hence why Hospice Nurse Julie was born, and I'm making this video here for you today.